We're starting a new chapter, and the chapter we're now starting is how to use the pliers. There's a set screw right here in the plier handle, which you're going to titrate when you receive your pliers so that you can create an automatic 1/2 millimeter deep bump. And for the most part, once you set these things, you don't really mess with them afterwards. When you receive your pliers, each plier comes with a small Allen key. For the yellow, the blue, and the white, you're going to probably do this. Any of the pliers that have a finger, there are other finger pliers that look sort of like that, like the bubble plier. There's one called the bubble plier. There's a bite plane plier. They all need to be about 1/2 millimeter deep. Next, you heat the pliers. In front of you, you should all have blazer torches. Okay, how these torches work, just so you know, if the hole is open, the torch is locked. Slide it over. If the hole is blocked, the torch is on. Do not point this towards yourself. Point it away from yourself, please. You're going to count to 3 when you heat only one side of your plier in the heat. Okay, so when you look at your pliers, one side looks like a finger, the other side sort of has a hole, a receiver. The finger is the part you heat. And keep in mind, you do not heat both sides of the plier because only one of the beaks is actually tempered. If you heat the receiver side of the plier, it will break. Now, this is a thermometer. The part that actually measures the temperature is this piece right here in the middle of the peace sign. So you take your plier, after you heat it, turn it sideways, and lay it down on the peace sign. So remember, the middle of the peace sign, that's actually where the sensor is. So you're going to go like that. See how this moved a little bit over here? And it's telling me that my thermometer is telling me that my plier is 73 degrees right now.
So you're actually on those wires?
Yes, I'm absolutely on the wires right now. Yeah.
You have to be in the center?
You must be in the center. That only the center is accurate. Okay, now, that being said, when we do the MTM system, the plastic you use is called ACE. How do you know it's ACE? Very simply, ACE plastic has the green label. It says Essex on it. Only use this or C+ for doing MTM. Different plastics, different temperatures with the pliers. Now it gets a little complicated. So, ACE is 245 degrees. How the heck do you know what 245 is? It's very simple. Overheat your plier. Put the plier on the thermometer and watch it cool. So if you count to 3 or 4 seconds, your plier will easily be over 300 degrees. And then you're going to watch the thermometer as it cools. And when it gets to 275 degrees, take it off, and let's put a thermo bump on our aligner. 275 is when you can pull off because you lose about 10 degrees per second that you're away from the thermometer. And it's going to take you about 3 seconds to orient yourself. So the C+ plastic requires less heat. The pliers should be at 200 degrees. I just want to make sure we understand the bump physiology here, okay? The plastic requires that you heat the plier. If you heat the plier, you get softening of the plastic will thin. If you do the bump cold, you'll still make a bump, right? We all understand that? Is that good or is that bad? Bad. Why is it bad? Because the bump will not crush. We want the bump to fail over the course of the month because when they come in month number 2, we're adding another 1/2 millimeter underneath it. So your bump that's a 1/2 millimeter tall today will be 3/10 of a millimeter in 4 weeks. Underneath that 3/10, you're going to add 5/10, 1/2 millimeter. It's now, on month number 2, 8/10 of a millimeter tall. The 8/10 of a millimeter tall bump will go another 4 weeks, and at the start of the 3rd month, your 8/10 of a millimeter will become 0.5. It's going to crush again. Now you're going to add another 0.5 millimeter underneath it. So starting on day 90, you now have a 1 millimeter bump underneath your tooth. Why is that clinically significant? Because the tooth was not ready to move on day number 1. That's why we always use a 0.5 millimeter tall bump. And if you make it to month number 4, your bump will be about 1.3 millimeters. Okay? So what happens around month number 4? Let's make a new retainer, a new MTM aligner. So a basic Hilliard kit comes with a burner, a thermometer, hit tacks, and these 8 pliers. I'm going to tell you, this is Neil's way of looking at the pliers, okay? At the end of the day, I hear the same questions every time. Number 1, are the colored rings, when I get my pliers, are the colored rings going to be on the pliers? The answer is yes, they will be. They come that way. What happens if the colored ring comes off? Well, it's still the same plier. You're going to actually learn how to recognize the pliers. You won't need the colored rings. We don't have colored rings on ours. But I do break the pliers not into color issues, but into categories of purpose. I want to say one set of pliers is good for retention, a second one is good for the hit system, and then the third one is what I call for activation, for actually tooth movement. So let's go through with the retention pliers first. Our rules when we're doing MTM in office is that the activation of the appliances should be about every 4 weeks. It shouldn't be any sooner. I really think if you come every 3 weeks, it's likely that you could overload a tooth. And I don't think, since you're relatively new at this, that it makes a lot of sense to push it. As far as I'm concerned, you have no business putting a force point in if you don't heat the plier. I know you can do it, but you're likely to hurt a tooth. And then the most important thing is you can't go back into the same hole over and over and over again. Okay, so we're going to start with my first category of pliers, which I call retention pliers. Retention pliers basically mean they make things fit better. First plier we're going to look at is the red plier. If you look at it, you can pull it out. Now take a peek. Can I borrow your plier just for a second so I show on the Elmo? How you're going to recognize this plier, both of these pliers, legitimately, when you look at the ends, it looks like a goalpost. See the goalpost right here? So look at this. This and the purple plier are the only two that look like this. Okay? So the red plier is designed for making a loose aligner tight again. How do you do that? This is the one time you don't necessarily screw it in for a 0.5 millimeter. That's why we don't titrate them all. I need this thing to pinch in and keep the aligner tight on the teeth. So how are we going to do that? You heat this plier up and you punch the plastic on the papilla, underneath the proximal contact, wherever it's loose. So let's say your aligner's loose on the right side. So starting at the canine, so the interproximal contact of the canine first bite, between the 2 bites, between the second bite, first molar, and potentially even between the 2 molars. You will heat the plier up, measure it down to 275 degrees, and go make a punch on the aligner in between the teeth. In this scenario, you can do both inside and outside. Your retainer will get very tight in a hurry. So that's why we're doing a punch greater than a 0.5 millimeter here. I do not want you to kill the plastic. Just make a dent in it, okay? You don't have to kill anything.
Where do you apply the dimples again? Between the premolars and...
Starting at the canine, going distally, you're below the proximal contact on the papilla. So you're actually putting the punch on the papilla. The soft tissue will deflect from the plastic and it will grab tighter. The only other plier I want to put in the category of retention is the purple plier. The purple plier has several different uses. For this use as a retention plier, if you have an older patient who's had periodontal surgery and they've got long junctional contacts, you all know what I'm talking about. They've had old school surgery where they mowed down the bone and made it all even. And they got big ugly gaps between their teeth. Everyone knows what I'm talking about, yes? How do you make an aligner tighter there? You can either make them another one or take the purple plier as opposed to the red plier and just lightly punch it between where the roots are exposed. That's using the purple plier to make an aligner tight. The purple plier has another use as well. My next category of pliers is going to be called activation pliers. The activation pliers are going to be designed, thank you. They're going to be designed so that we can go ahead and actually make a tooth move, okay? Most of them are going to look like a finger, okay? But even with activation pliers, they come in two sizes and shapes. One looks like a finger and one looks like a circle. Okay? So the first one we're going to talk about is the mesial distal plier, the purple plier. I'm going to tell you now that the names have no bearing on their purpose. They were named 15 years ago. I'm not about to rename them. I'm all about using the colors. So the purple plier is an excellent activation plier when you don't have a lot of width exposed on a tooth. So lower incisors, purple works pretty good. Lower canines, purple works pretty good. Its real purpose isn't really even to push teeth out. Its real purpose is to close gaps up between 7, 8, 9, and 10. So if you had some light spaces between your front four incisors and you wanted to try and gather the teeth up, on the model, before you put it through thermoforming, you'd have to take your fill-in, that clear stuff, the clear silicone, or you'd have to take barricade or flowable composite, and you'd have to block out the interproximal contacts where the spaces are. Because you don't want the plastic to dive into those interproximal contacts, or you'll never get the teeth to slide together. So after you block the model out, you're going to put it through and you're going to make an aligner, trim it, and polish it. It comes back, and now you're going to take the purple plier and you're going to activate distal to both the lateral incisors. You're going to put a blade of plastic distal to the lateral incisors. And what it does is it takes all four of your incisors and it shoves them together like this. And when that happens, all four of the gaps here, or all three of the gaps, because there's three proximal contacts between 7 and 10, are all going to close. The problem is now you got a space here and a space here, right? Now you got an aligner where you have a space distal to the lateral on the right, a space with the distal on the distal to the left. At that point, you got to make another aligner. So that's the real purpose of the mesial distal plier. But when you look at the purple plier, now pick up the blue plier, you'll see that the blue and the white plier look very similar to the purple plier, with the exception of the purple plier is thinner. So in our situation here, what the purple plier can act as is it can be the first punch before the blue or the white. Remember, your next punch needs to be wider, needs to be in plastic. So if your first punch is the skinny purple plier, your second punch theoretically could be the blue or the white plier because they're fatter. Everybody follow that? So now, from purple, the next one up potentially is white. Same looking plier, same shape from the side. Thicker would be white. What's a little smaller than the white is the blue. The blue one is called the mandibular plier. Yellow one's called micro ramp. The white one is called maxillary. Again, names are irrelevant. Color schemes are important though. So, well, hang on, there'll be a slide here where it'll make some sense. So again, small, medium, large. Smallest is yellow. Next in line is purple. Then comes blue, and then white. Those are all finger-looking pliers. Again, yellow, then purple, then blue, then white. All four of those in a row are small to large. The yellow one is so small, it has no business in the upper arch at all. It's good for the lower arch, but not good at all for the upper. And when you use the yellow plier, No one said you had to use it once. You can use it up to 4 times in the same day. And I'll show you why in a second. Changing shapes. This is the circle plier now. This is the large gray circle plier, which is part of the basic kit. This is the first plier I look at when I know I want to move the central incisors in the upper arch, because it covers the most real estate when it punches. And you know, central incisors 8 and 9 are so big, they really need a decent sized punch in order to make them effective. Now, it may not be the first plier I'm going to use, but I'm going to use it. So I may start with the blue or the white plier. I won't start with yellow, it's too small. But I may start with blue or white, and then on top of that I would do the large gray. These are the hit pliers. Here's an easy way to know. This is the third category, the hit pliers. How do you know the hit pliers? You'll know them because they don't have any colors on them. So in front of you, you'll see red, purple, you'll see gray and pink, blue and white, and yellow. And then you'll have 2 more which don't have any color rings on them. Most of your kits have a pink plier in them, correct?
Yes.
Okay, the pink plier is not part of the basic kit, but the pink plier is a small circle. So if you're doing upper incisors, I like starting with the pink, which is the small circle, and then I usually make my second activation the gray circle, which is the large. When you look at them from the side, you'll see this in a minute. I'll show you, it creates what we call a wedding cake effect. So the hit pliers, these 2 are unique. You're going to use 3 pliers with the hit system. This one's a hole punch. This one's the tack placement plier. And the third plier you're going to use is the large gray circle. Now the problem with the large gray circle is that you need to heat it up. It's the only time you take a plier and you put the hot part inside the aligner versus outside. It looks something like this. So the deal with the hit system is we're going to create a hole in the aligner and we're going to press a tack into it. A hook, if you will, okay? When you cut the hole in the aligner and you press the tack in, that tail that's going in the hole is actually going to stick out the aligner and touch the tooth. That's a problem because we know when we put something on a tooth, teeth move, right? So we can't do that. So the only thing you can do is try to push the plastic away from the tooth a little bit so when you cut the hole in it and press the tack in, it doesn't touch the tooth. So we're actually going to push a platform out. In order to do that, we're going to use our large gray circle. When you get a large gray circle from the box when it's brand new, it doesn't even fit in the aligner. They're too big. So when you get a new set of pliers, you actually have to modify this plier. So look what I did. Does everybody have a lathe in their office? And usually on the lathe there's a stone wheel, right? What you do is, as opposed to being on the edge of the spinning wheel, the wheel spinning this way, use the side of the wheel. Don't use the edge because the edge actually is it's round and it won't leave a flat surface. So just take your plier and push it out along the side of the wheel and reduce it so this is about 2 millimeters tall. What happens if it suddenly fits into the aligner much better? Does everybody follow that? Okay. So you kind of have to put it, if you're planning to get a plier kit or you have a plier kit and you've never been taught how to use it, hopefully you're going to feel like you know how to use it at least somewhat today. Put an asterisk by your book here because this is something you got to go home. This is a little bit of homework. This is not something you got to remember. It's just something you do one time, you modify your plier, and then you're good to go. So that's the difference. Unmodified on the left and modified on the right. And if you're going to push a platform away from the tooth to put a hit tack, it's really important that you try and get it into the aligner. Otherwise, you're not going to get it, you're not going to get far enough away. The tail, when you attach the tack to the aligner, is going to put pressure on the tooth, and then ultimately your tooth is going to move, which is bad. So the third plier you're going to get, the second plier then in the hit system is a punch. And the punching plier, you're going to use it to punch a hole in that platform. So you're going to have like a little area pushed out, and then you're going to put a hole in it, and then you're going to place a tack in the hole. If you're using the small and the large circles, let's say, to push a central incisor in, the large gray circle is the large part of the wedding cake. That small protrusion there, that's the pink circle. It's about the only thing you really need to be complete, to be able to walk out of my class today and go back to your office and be successful. You really kind of need this pink plier. So in the event that you have the pliers back in your office already, check to see that if you have a pink one. But it's a mated plier to the large gray circle. And it really gives you a lot of variety for your upper incisors to tweak. And you know as well as I do, once you get comfortable with this, every time you see an incisor that's off, you're going to be like, oh my God, I have the perfect solution for you, right? This is the order of the colors that you will use in the mouth to activate an aligner, okay? And all you have to know are these 3 slides, and that's it. There's nothing else for you to know, okay? So yellow, purple, blue, white would be one order for doing like a lower incisor, okay? Your next order would be for doing an upper incisor. So if you're in the upper arch, you can start with the blue and then go to the pink plier and then gray, or you can start with the purple, which is super skinny, then go to blue, and then white maybe, and then gray. If you're moving around though, as an example, so again, if your last 2 slides, your last 2 activations were over here, and now the tooth rotated and you wanted to put it straight back, and you were going here, number one, there's no reason why you have to do a new aligner, because all this plastic here is virgin. It hasn't been punched yet. This punch over here can be any color you want to start with. It could be pink, it could be blue, it could be white, it could even be gray. And depending on what the aligner looks like, you can maybe get a couple more months out of it. So the thing I want you to appreciate is that simple rule: if it glows, it goes. If the aligner looks good, then you're in good business. Remember, you want to create patient emissaries. You want people to build your practice for you. But if it looks really beat up, just replace it. I mean, it's less than $10 to replace the aligner. Your effectiveness will be increased. Your patient satisfaction will be increased. Your success rate will be increased. Right? Everybody follows that? Okay, perfect.
Documenting at each appointment when you start off the learning curve, what color you're on, so.
Yep. So what do you write in your chart? Thank you. That's actually an excellent question. Patient comes in, and they're going to come in, they're going to get activated. What did you put in your chart? You don't have to put the depth of the punch because it's a 0.5 millimeter. You already titrated. So once you set your pliers, I say take a piece of blank plastic. You don't have to bother heating them. Make your punches so they're 0.5 millimeter. When you know they're good, put a drop of crazy glue on that little Allen nut so it doesn't move. You can still move it if you have to, but it just keeps it from moving. That's a good pearl. You can write that one down. Put a drop of crazy glue right over that little tiny screw where the Allen key goes once you've adjusted these. And then as far as what do you write in the chart, you would write the color of your pliers and the location approximately. So you might write blue mesial buckle, number 9. So in cryptic terms, you can put blue MB9. Don't have to write a lot. You just have to be able to understand it for your own purposes. Okay, so here's a tricky one. Lower incisors, not a big deal. Lower canines, really hard to turn. Very effective with this system, but you got to follow my rules. So my rules are pretty simple. Number 1, When I'm rotating a lower canine, specifically, I punch from both sides, buccal and lingual. Kitty corner, if you will, right? Mesial buccal, distal lingual. Remember, we're trying to create a couple where both sides are turning in the same direction, whether it's clockwise or counterclockwise, they'll be on opposite corners. So if you want to use your yellow pliers, because you don't have a lot of surface to activate on with the canine, you can put one yellow punch as high and one as low as you can go. So they'll be on top of each other. So in theory, here's my canine, and we'll say it's kind of rotated a little bit, where it's rotated like that, right? So if I was going in and actually doing some orthodontics, my goal would be to make the actual rotational movement look like that. Everybody with me so far? Because I want to unrotate the way it presents. So when you look down on the tooth, here's my canine. This is lingual. This is labial. Labial. That's lingual. This is mesial, and this is distal. Okay? So now, if I want my tooth to do something like this, that's the rotation I want. Okay, first of all, where's my force activation points going to be? Right? So I'm going to have one here, right? I'm going to have one here. Next question. Where's my blockout going to be? Tough question. I got blockout here, right? Because this whole area is coming, but I also have to have blockout here. Right? Everybody follow me? Yes. So when you look at your tooth like this, literally draw a line on it, and then cover this whole thing with barricade or fill in that clear stuff, right? So literally, from the line over, you block it out so the tooth can move. Does everybody follow that? Yes? Okay.